Welcome to Men's Preferences for Workplace Health Promotion Programs and the Effectiveness of Tailored Approaches. This webinar is co-hosted by the Institute for Healthy Living and Chronic Disease Prevention at the UBC Okanagan campus. We're glad you're here. My name is Angie Hunt, Project Manager with the Work Wellness and Disability Prevention Institute, and I'll be moderating the webinar today. The webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWDPI. While we're waiting for others to join us online, I'll go over a few technical points for the webinar. You should be able to hear the presentation through your computer speakers or through the conference call line if you dialed in. Please use the question box to submit any issues you may be experiencing, as well as to ask any questions you have related to the presentation. We will collect questions submitted throughout the presentation and follow the presentation with a Q&A based on the questions submitted. Following the webinar, any questions not answered in the allotted time will be answered and distributed after the event. The presentation will be recorded and posted for free on our website within a week, along with the slides. You'll be emailed the direct links for all these items when they are available. As I mentioned, my name is Angie, and I'll be moderating the webinar and Q&A session. Our presenters today are Christina Capriccioni and Joan Bodorf. Dr. Christina Capriccioni is the Associate Professor in the School of Health and Exercise Sciences at the University of British Columbia's Okanagan campus. Her program of research focuses on population and community health promotion, with particular concentration on physical activity and at-risk or hard-to-reach populations. Dr. Joan Bodorf is a professor in the School of Nursing and director of the Institute for Healthy Living and Chronic Disease Prevention at the University of British Columbia's Okanagan campus. Her research program focuses on health promotion and health behavior change in the context of cancer prevention. Current projects center on men's health promotion and developing gender-sensitive tobacco reduction interventions. And now I'll hand it over to Christina and Joan.
Great. Good morning, and thanks for the introduction, Angie. And thanks to everyone for attending today. Joan and I are really excited to talk to you a little bit about our work in gender-sensitized approaches for men's health, and particularly in the setting workplace health. So if we look at the bigger picture here, we know with regards to men's health that there's two specific components that the research is telling us. One, men don't live as long as women, and number two, men don't actually go to the doctor or seek healthy behaviors. And if we look, if we look at each of these separately, we have some really good research and statistics to support this, indicating, as you can see here in this graph, although we see an increase in life expectancy across both sexes, what we do see is this gap between men and women, and this continues to develop. And at the present time, we see that men actually don't live as long as women. It is predicted that, I believe, by 2031, we will see that approximately men will live to about 81 years old, whereas women will live to about 86. So we really need to consider this gap and why this is happening and how we can approach it. As we move along, we also notice that part of the reason why this gap is occurring in mortality rates is the fact of these leading causes of death among males. In particular, cancer is the leading cause of death, and it's more often occurs or develops in men than women. This is closely followed by diabetes, heart disease, as well as an increase in suicide of men. And we see about 75% of suicides actually occur in men. So further justification as to why men are not living as long as women and how we approach these health concerns. What we do know is that many of these risk factors that occur are from preventable causes and lifestyle modifications. And again, men win here as well. We see about 95% higher for men than women with regards to preventable causes, things like lifestyle modifications, physical activity, healthy eating, how we maintain or reduce or keep a normal weight, smoking, and different health behaviors. Versus treatable causes, which is about 20% higher for men than women. So we're starting to see this real justification as to why this gap occurs between women living longer than men, and a need for us to do something about this, to close this gap. Secondly, if we look at the bigger picture, we also know that men don't go to the doctor. Some research has indicated reasons why this occurs, and some of the top 3 reasons: too busy. I mean, that's usually a reason for both men and women, but that's the #1 reason. Too busy to go, afraid of finding out what might actually be wrong or something happen, and of course, getting uncomfortable with body exams, particularly for men with regards to prostate or rectal exams. And as we move along and as we talk more, and when Joan gets into more details, we will notice a number of complex factors that affect this. And one of the biggest ones that we will be talking about is sex and gender. One of the other reasons, particularly why we might see that men don't actually go to the doctor, might be for the reason is they don't actually have a doctor. They are less likely to have a regular doctor than women, as you can see here, and therefore part of the reason why they don't seek healthy behaviors. If we start looking at those preventative causes that we talked about, in particular physical activity, healthy eating, smoking, overweight, obesity, we do see some really good research showing that if we look at physical activity in particular, we do see that men are actually more physically active than women. However, the important part is here, the majority of them are actually not meeting the minimum physical activity guidelines in Canada. And when we talk about minimum, this is where we first start to see health benefits. So of course, doing more is better, but we don't even get 83% of men are actually not even getting to that minimum limit, and that's scary. So how are we going to approach that? In addition to physical activity, we have this idea where men are not really eating healthily, and partly because of the idea that men prefer man food. And when we mean by man food are things like this picture depicting red meat, alcohol, beer, things that aren't recognized as feminine, which we also see would be things like fruit and vegetables, yogurt, healthier food options. So why is this occurring? And this really hits home with regards to fruit and vegetable. As you can see here, men really are not doing well on this front. So they're only consuming about 3.5 fruit and vegetables a day, which is really below the minimum average, whereas women are a little bit higher. So adding to that gender gap regarding what men are not doing and why they're not seeking those healthy, health-promoting behaviors. On top of that, this is a trend that we do see across both men and women, but the interesting part here is that we see this trend in men's weight where normal and healthy weight is actually decreasing and overweight and obesity is increasing. And this has tripled over the last 10 to 15 years here in Canada, and we see this trend across many other countries, the US, the UK, Australia, New Zealand. So adding to the point is that we have this increase in weight gain, this increase in obesity, and this decrease in health-promoting behaviors that might help manage this weight. So one thing, too, I want to point out here is not only are we seeing this increase in overweight, but the scary part is the real increase in obesity. And this continues to happen. As you could see, men are becoming more obese and at a more obese stage. Class 2 or 3 is continuing to increase. In addition to the physical activity behaviors, to the healthy eating, to weight management or weight gain, we also know that men are still smoking more than women. And this is particularly seen in the age groups from 20 to 34 and 35 to 44 age group. And although that overall smoking is decreasing, we're still seeing this increase in men compared to women. So the idea is, how do we look at all of these health behaviors, these health promoting behaviors, and how can we develop programs, care programs, to really close that gap between men and women? I mentioned before there are many complex factors that impact men's health as well as women's health, but some of the recent research, and I know research that Joan and colleagues have been doing here for a number of years, is the idea around gender and masculinity and how that impacts men's health. And this is a really great picture just indicating the idea of strength, how men see themselves, strong, and the fact that it's happening very early and throughout the age group. So we have this young boy who looks up to his father or other father figures and making sure that, you know, they grew up with masculine traditions, that strength that epitomizes men. With that, then, many of the health-seeking behaviors are obviously known as or stigmatized as feminine. So it doesn't really connect with traditional masculine values or masculinities. In light of that, and with all of the information given regarding men's health, what we do see is this not only has a large effect on mortality rates, but also a large effect on the cost of preventing mortality or preventing some of the chronic diseases we discussed. The really great part of this, and knowing that 95% of those risk factors are preventable, is just by being active, by quitting smoking, by shedding weight, and by reducing alcohol and increasing our healthy intake of food, we could actually prevent these costs, as well as obviously all of those chronic diseases and mortality rates, by up to 70%. So something really to think about. How do we put our efforts into programs that will help with these costs, as well as help with men's health overall? One thing we do know is that one size doesn't fit all, and that the generic programs that we have developed in health promotion don't necessarily fit the needs or preferences or interests of men. And we need to pay more attention to how we can engage men, how we can reach them, and get them to actually be engaged in those health-promoting behaviors and health-seeking behaviors. So recently, our group here, as well as Joan for many years, and with our other colleagues, we have been working on some gender-sensitized programs, really focusing on the components and the aspects that interest men, that engage men, and that really attract the masculinities that they value. For example, we have right now a couple of programs that we just wanted to highlight regarding this. And one of the programs is Quit Now Men, and this is an online program. And we know that men are actually attracted to or engaged in online programs, not just necessarily health, but just online. So this was a way for us to maybe reach them, to get them involved with regards to quitting smoking. In addition to online programs, we know that sport and camaraderie or teamwork plays an important aspect in men's life as part of their traditional masculinities and their values and virtues. So we've also created a program that we refer to as Hat Trick, and this is a face-to-face program where we have a group of men come together and really build on that camaraderie and the interest they have in sport. So these are just two examples of modalities of how we would deliver health-promoting behaviors. One area that we're starting to see some real interest in, and specifically with men, are looking more at the settings. So setting-based approaches where we can meet or reach men. And of course, one of the settings that we think is a great way to reach men and engage them is the workplace. Partly because we know that 75% of Canadian men are in paid work, and they spend many waking hours at work, like most of us do in full-time work or part-time work. So this is a great way to look at how we can engage men in health-promoting behaviors through the setting. In the past, most of the workplace health promotion, next one. And part of the reason is we do have some really good research that has looked at workplace health promotion programs overall in the general population. And we know that there are many benefits for both employees and employers. So for employees, we see this boost in morale, we see reduced turnover, retaining employees, we see increased productivity. One of the big ones, also one of the big benefits, is that workplace health programs actually have shown to reduce absenteeism by 1.5 to 1.7 days per year per employee. That's an estimated savings of about $251 per employee. So we're obviously starting to see this cost benefit and return on investment. In the past, though, many of these workplace programs have really focused on the idea of safety and workmen's compensation issues from injuries. And not a lot of the focus has been put on health-promoting behaviors and how that can actually be intertwined within the workplace in that setting. And this would be a great way, of course, because we see the data, that would also impact safety and reduce workmen's compensation issues or concerns. In saying that, we did do a small little study just to get an idea of what employees think about workplace health promotion, specifically around physical activity, healthy eating, and other lifestyle behaviors. This was a study that we did with both employees from non-management groups as well as management groups. So we wanted to see the difference in perceptions between the two groups. And so we had a good portion of men participate in this. Often this is not the case with these kinds of studies, but 40% of men were the ones that were participants. We looked at we talked to a private insurance company, an academic institution, a government civil servant organization, and a large chemical company. And really, what we found was that participant responses really revolved around three major themes. The role of the company in supporting or providing health promotion programs, the most successful elements to get these going and get employees engaged, and this idea of mandatory participation, which I will talk about in a minute. The idea of the role of employee, we kind of got a little bit of a discrepancy between management and non-management groups, where the non-management employees really emphasized that it was the employer's responsibility to provide these programs, to provide support, and to get employees engaged. Whereas the management, although they agreed that they did have some responsibility in providing some sort of programming, it was really the personal responsibility of the employees to get involved. So that was an interesting little bit of discrepancy, particularly when we're talking about who supports the programs and how they can be successful. When we moved along and talked more about both to employers and employees regarding what makes successful programs, we did see that both did understand that there was a need for commitment on the organization's part. And part of this commitment was the idea of open communication where employers and employees work together to develop programs and to make decisions on what was available. And one of the most important aspects was the idea of putting some investment in these programs, providing some funds and making it part of their strategic plan, as well as providing flexible program options. This last thing was really interesting that came out. At the time when we were looking at this, there was some really good research about the idea of having mandatory health promotion programs. So we wanted to find out what employees and employers thought about this. Well, this was really met with a lot of resistance from both groups, actually. The employees did not feel that they should be told to be healthy, as well as the employers felt that if they made things mandatory, that they would have much more resistance. However, that open communication and really providing the time to develop programming with the employees was a really important aspect as to how it may not be necessarily mandatory, but really important to engaging the employees. So some common responses that just came out of that around some of these main themes was the idea that, one of the employees from a non-management assistant from a chemical plant was saying, I think is also allowing people to take the time during the day. So this idea of flexibility, like the place I worked at for, let us play hockey at lunch. I think a company's responsibility is to allow you to do that. So this idea of being supportive and being committed and allowing some flexibility so the employees could be involved. In turn, from a management perspective, they did agree that it was partly the responsibility of the organization to actually just show up and be committed and invest in their employees because of the great return. So standing up and doing it, showing that we are accepting of it and behind it. So really showing that they have an investment and are committed to getting our employees up and running and being active and eating well and other health promoting behaviors. So on top of that, I'm going to pass this along to Joan so she could provide further details about some of the gender sensitized programming that we've developed.
Okay, thank you, Christine. So we were also interested in, employees that work in male-dominated industries and what they're interested in. We often think that men aren't interested in health promotion, so how do we go about introducing health promotion programs in these kind of industries? And so we did conduct telephone, online, and paper surveys to a group of 227 men who responded to this. You can see there their average age was 43. And as you can see, we have a little bit of diversity in the sample, although not huge. This was carried out in northern British Columbia, and so there were some Indigenous male employees at some of the workplaces. And here you can see the industries that we surveyed. Trucking companies, a shipping terminal, a municipal public sector, so people who grade the roads and take care of communities, a chemical plant, and also a mine site in northern BC. And lo and behold, when you look at this graph, you can see that actually men are pretty interested in wellness topics and a wide range. They're interested in being physically active, healthy eating, managing stress, even screening for cancer, and reducing environmental carcinogens. But also, almost half the group was interested in topics related to smoking and exposure to sun. So, really, we have a group that's interested in wellness. And so how can we begin to develop programs that actually address those interest areas? And so we decided that what might be really helpful is to actually hold some focus groups with male employees. And these weren't from any particular workplace. This was a group that we just invited from the community. And we held 2 focus groups with 21 men in total. And we wanted to explore the barriers and facilitators to introducing workplace programs in male-dominated industries in particular, to look at some potential ways we might deliver that program that would fit in those workplaces and be acceptable to them, and to get some preliminary thoughts about some ideas that we had based on our other work in men's health promotion. And so we've published that work, but I just want to highlight some of the things that we found out in those discussions because it was really very helpful. Men in this group, and as I say, they were from northern BC in these male-dominated industries, sometimes working in quite harsh conditions, and they really prided themselves in their ability to work in these sometimes difficult conditions. And really being healthy for them was really tied up with being able to work, to sustain their paid employment, to be able to support their families. And for many of them, this was very important because some of them were hourly employees, or they didn't have continuing positions. So if they didn't show up for work, they didn't get paid. So being healthy and strong was really important in order to support their families. And so when it came to healthy eating and physical activity then, these were constructed in ways that would support them in their efforts to work. So for example, the things that influenced their healthy eating were things like access, work schedules. They wanted food that would fill them, and they constructed food as fuel. As one man told us, I can't just stop work every 10 minutes and have lettuce. So he needed some food that would actually carry him through to the next work break. And it needed to provide him with enough energy to get the job done. So those were the concerns around food. And it needed to be quick because men often were working long shifts with their family responsibilities and their work responsibilities. They didn't have a lot of time. So they gave us some good ideas about how to message them around healthy eating and what might work for men. Around physical activity, again, men actually saw, particularly men's work that involved manual labor, saw their work as actually being part of the way they stayed fit. But they also knew that they needed to stay fit to be able to do the work that was required of them and to keep their jobs. And so being fit was also important. At the same time, when it came to their recreational physical activity, there were time constraints, but also sometimes financial constraints, because they often put their families' needs for recreation ahead of their own, and they wanted to support their families and would then often didn't have enough resources or time for their own recreational needs. So they suggested there may be some opportunities to actually integrate other kinds of physical activity in their workplace that might be of the recreational kind. They also told us that their ability to engage in healthy eating and physical activity was also influenced by some norms in the workplace. And sometimes these were restrictive masculine norms. So as Christina mentioned, if a fellow was eating lettuce for lunch, he might be teased by the other workers around him because it wasn't really manly food, and he'd be challenged on that. And so, because it would be seen as a feminine or dieting, and dieting is sometimes seen as feminine, something guys don't do. And so, although these masculine norms could be restrictive, they also suggested there was an opportunity to change, and that if there were some strong, respected individuals in the workplace who were making some of these changes, that other people would join in, and if it was a group activity, people would join in, because if everyone's doing it, you don't want to be left out and be the only one who's not doing it. So if we could insert champions, that there offers a possibility for change of norms in the workplace. They also suggested that any messages need to be simple, with hard facts, visual, and really provide some tangible ways of monitoring their progress. So they gave us lots of great ideas that we might integrate into a health promotion program that would fit for these particular men. And so we took this information, as well as some of the other things that we had learned about men's health promotion, and began to develop a program called Power Play for these male-dominated industries. And we were particularly thinking about these resource-based industries in the north. And the components of the program were, of course, some program resources, and these included promotional posters, but we also included some toolbox tips, some tools for self-monitoring, some infographics. We developed challenges because we thought that would be a way of bringing groups together to encourage each other and support each other in making behavior change. And we knew that this had worked in other settings, this idea of a challenge. And so, and we know that men are always up for a bit of a challenge. And so the program was based on group challenges. We also included some consultation for employers to implement the program and a review of workplace environment policies, which also could continue to support some of the changes we were hoping would happen in the workplace. The messages that were developed as part of this program were simple, straightforward messages that would appeal to men, focus on things that matter to them, would be clear and direct, and strength-based, really playing on men's strengths and masculinities. And so here you can see one of our posters, Eat Well and Be Active, so that you can work harder, live longer, be stronger. So again, playing to those masculinities that men prided themselves in. And of course, their desire to be able to work and support their families. So the first challenge was a step challenge, and we had workplaces give workers pedometers and form teams. And because this was in northern BC, we had them do the Great Northern Circle Route Challenge. And the groups were challenged to add their steps together to go around this route. And it was put up in the workplace so that people could see the progress of all of the groups. And this occurred over a 8-week challenge. So there was lots of time to get around the circle, and if they happened to get around it, they started again. We also, we road tested this program in 4 workplaces in northern BC and worked with employers to do that. It was 2 trucking outfits, a coal terminal, and the municipal city crews group. We did evaluate the implementation of this road test in these workplaces and through a variety of methods. So we did both pre and post survey data that we collected from men in these workplaces. We also did some interviews with the workplace leads who were implementing the program, both at midpoint after the first challenge and then at the end after the second challenge. And of course, we kept some field notes all the way because we were in contact with workplace leads throughout the program to see how it was going, to help problem solve, et cetera. And so we kept field notes. And so we kind of knew how things were rolling out. So before I get to the next slide, I might just indicate that that the overall results of the program were quite favorable. We were able to increase physical activity significantly. So by the end of the program, 72% of the group responding to the survey were able to meet physical activity guidelines compared to 58% at the beginning. We didn't really budge the fruit and vegetable consumption, and budging fruit and vegetable consumption is one of the hardest things to do, but we learned some things through this road test of the program that we have now tweaked our efforts to budge the fruit and vegetable consumption and are hoping that it's going to work better. But we were also, besides you know, the kind of hard endpoints to this program evaluation, we're also interested in what employees and workplace leads had to say about their experience with the program as well. And we were interested in this because we wanted to know if there are ways we could improve the program. And so here's the employees that responded. You can see here that the majority were satisfied with the program. They thought the handouts and information graphics provided very useful information. They thought the program was tailored for them, and almost 3/4 would recommend the program to other men. So this would tell us that, in fact, we can do health promotion programs in male-dominated industries in ways that are acceptable to men. So what parts of the program did they like the best? And here's a few quotes. They liked the fact that they could log their steps and see how they were going. They liked the competition. It motivated me and kept active. And this was really evident in one workplace. It was a trucking outfit where the supervisor challenged his employees to keep up to him. And he had a hard time keeping ahead of the employees, and the employees had a hard time keeping up to him. So it was like a win-win. And that kind of just natural everyday competitiveness really added to the success of the program, is that enthusiasm in the workplaces. And it got guys together to be active. It was good team building. I believe it encouraged prolonged activities in the workplace. So those are really positive outcomes of a very short workplace health promotion program. They also had some suggestions, though. They wanted us to make the challenges easier to understand. Our second challenge was a little more complicated. It was around a hockey theme and healthy eating and physical activity. And the recording of the groups and the members in the groups was just a little more complicated than the first challenge. And so they were basically telling us we needed to simplify it, which we did. Keep it simple, make it easy, make the tracking easy. Have it online if you can. Do it more often, do it annually. So that's kind of interesting. And one man wanted more competition. We men were very competitive with one another. And you know, the prizes weren't much. They were just small prizes, but there was a lot of cachet and just bragging rights as well. So it doesn't mean that we need to have great, huge incentives here. So here are some of the quotes as well. This is from one of the male truck drivers. It built up a little competition, and some guys took it to heart and did fantastic. It helped bring people together in the workplace. We also asked them if they noticed any changes in the workplace environment. And some of the employees told us, well, they set the place up like a recreation center that's used, and it's used for free at any time. And another man said, instead of leaving right after work as a group of guys, we do a lap around the building before we leave. Another person indicated that people have left, the employers have left up some of the posters and infographics that provide some inspiration to keep going. And other changes around healthy eating, I think this one's interesting. It looks like they started replacing the donuts with fruit. Some of the workplaces started putting a fruit basket, you know, just some apples, something simple in the lunchroom for men to just eat at lunchtime. And that had replaced kind of bringing donuts on a Friday, for example, from Tim Hortons. So sorry to Tim Hortons, but good for our Okanagan fruit growers. They're changing the selections in the vending machine. So again, a very positive environmental change that could actually support healthy eating behavior. At staff meetings, the snacks are healthier. And all the postings and emails that they're circulated, they make you think. So there is some suggestion that some environmental changes were also taking place that would support these changes. So that's great to see. So we also, in talking with the workplace leads, wanted to know how it went for them. And we asked them to estimate the amount of time that they spent on the program in implementing it. As you can see, per week, it varied quite considerably. And part of that related to the fact that for some workplace leads, this was just something they were doing off the side of their desk. And for others, it was integrated and made as really a part of their job and recognized as such. And I have to say that when there was very limited time spent, we had less engagement of men in the workplace. So what they had to say was they thought in terms of engaging employees that we had some launch events and of the challenges, and they thought those were key to actually building some enthusiasm and momentum around the Power Play program. They thought the incentive prizes and the competitions also were key engagement factors. And they told us that engagement was higher in the first challenge and less in the second challenge. So that told us that, you know, either we need a bigger break between the challenges or we need different types of launch events and things to introduce a second challenge. Feedback on the program, they also observed that men particularly disliked the tracking around their healthy eating, but they like tracking steps. And in some ways the steps, you know, there were actual numbers. Counting fruit and vegetables didn't seem like quite as exciting. So we've actually come up with a different way of tracking fruits and vegetables in healthy eating that's not about counting. So anyway, I think it's kind of interesting, but I kind of get it as well. Recommendations for future implementation, again, they talked about clarity and consistency around the rules. So we realized that although these are like low outcome, well, the challenges are pretty simple and the prizes are not great, but the rules need to be clear because this is obviously a competition. And so, you know, some groups were larger than others, so we prorated the steps, but the men wanted to be sure that this was fair. And so we need to be really explicit and clear about the rules so that people can see it's a fair competition. It's a big deal, especially when bragging rights are on the line. And of course, workplace leads told us they would have benefited from more support. It was a new program. It was the first time they were introducing it, and so we recognized that it might have helped them actually, we agree, to have a little bit more support, at least that first time around. So here are some quotes. Guys are still wearing their pedometers. There are tons of people who are still wearing them, even though it doesn't apply to the second challenge. Some groups are organizing sports events at the Racket Center. A lot of people were requesting hikes and started talking about current things we offer, and we could offer other things. They just generally started talking about wellness. So it's great to actually begin to see that conversations are happening. So if anything, Power Play helped introduce those conversations that weren't there before, which is wonderful. So we'd like to try and play a little video because I think it helps to hear men's voices. And it's only 2 minutes. We're going to see if this will work. Chiquetta's going to help me with it. I think you can just click on it. Yeah, it'll take you right to it.
There, we need that part. Did you click it?
No. Oh, sorry, go back. Okay. We'll see if it comes up.
Oh,
very good.
Looking good so far.
Good. Here we go. I don't have any sound.
It basically was a two-phase approach, so exercise and nutrition. At first I was like, oh man, this is kind of cool, right? It's like almost a new novelty. Let's do it. And then as you work on into it, it's like, oh, okay, this is actually really fun. We were a pedometer and just counted our steps, recorded that every day. And the thing that impressed me was how many steps I really take. Quite often end up with, 14,000 to 16,000 steps. We got them moving. The second part of Power Play, we tried to add in a nutrition element to it, and a lot of it is eating healthier too. And once I started doing that, it's like an unlimited supply of energy that you don't access until you nick the top of it. Well, it was important to me to participate for a few reasons. One, as a lead hand here, I need to be an example for the guys. Another thing is I've got little kids, and I'm 40 years old now, and I just want to live a long time to be able to see them grow. I've tried to continue eating healthy, and I'm still walking and exercising. You will see the benefits. There'll be less sick days, less injuries, just a happier workforce. And it's hard to measure that, like you can see it. If you had a chance to do this over again, would you? The answer is yes.
Powerplayatwork.com.
Okay, that's the little video. So I'll just go back to the presentation here. Okay, there we go. So I think you could hear in the voices kind of a reflection of some of what we heard as well from employees as well as the workplace leads, and how important a health promotion program can be for men to allow them to work and to support their families. And we have now a website that you're welcome to visit to give you more information about that, and I encourage you to go and have a look at it. So it's at the powerplayatwork.com. We have since refined the challenges based on what we learned from this first road test, and we've added some other modules or challenges to the program. So we have the Step Up Challenge, a Fuel Up Challenge that is around healthy eating that's a little bit different, but we've also added a Heads Up Challenge, which focuses on mental fitness. And again, this was informed by what we heard from men in terms of what they wanted. And we just recently added an Anti-Up Challenge, which is more of an individual challenge for men who smoke who are interested in quitting. And we are just trialing that right now at a mine site in northern BC. So we're hopeful that it'll be successful. You can find out more about these challenges on our website. So there's a coach's corner as well on this website. It is password protected, but all of the resources for the program are here so that they're accessible to workplaces wherever workplaces might be. Absolutely everything that's needed is there, plus a manual for the coach. The program is available to be offered. We've been delighted to win a few awards for this program, and delighted that workplaces have been interested in helping us evaluate it and develop it. What this program has told us is that men's preferences really matter, and particularly when we're designing health promotion programs that will engage men. And we recognize that not all work sites are like the ones that we've been working in, and there's a huge diversity of men in male-dominated industries. And not all men are working in these hyper-masculine cultures, work cultures, that many of the men that we've been working with are. So, you know, the program can be adapted, we think, to other groups, but we also recognize that we may need other versions of Power Play as well to meet the needs of men in the workplace. But I think what the bottom line here is that men are interested in health, and we can actually engage them in health if we do it in ways that actually resonate with them and engage them. And we believe one of those ways is through gender-sensitized approaches that can actually make a difference in men's lives. So I want to acknowledge our funding from the Canadian Cancer Society. Otherwise, this would not have been possible. And the large team that's behind it, Christina and I, and to acknowledge that actually we do have a few guys on our team as well, so it just wasn't Christina and I behind the scenes. And that's the end of our presentation, and we would welcome any questions that you might have.
Great, and to our audience online, if you have any questions at this time, please enter them into the question box on the GoToWebinar panel, and we'll read those out loud. I have a comment from someone online as well as a question. I totally understand about fruits and veggies. We leave apples in our staff room and hardly get any men to take one. During Christmas time, we left a few boxes of Tim Hortons donuts, and of course, every male employee went to the staff room to grab a donut. Some of the male staff never come to the staff room. So. And a question that came in, is the Power Play program an active study currently? Just wondering for updated results.
Actually, our funding is very quickly running out. So we are currently doing some work in a mine site in northern British Columbia. And we do have some data from there, but we haven't, it's still ongoing. So we haven't updated our results at this point.
Okay. Another question that came in, can you share a few examples of some of the rewards for the various challenges and any advice to someone who wants to implement this, perhaps?
The rewards for the various challenges, I'm just trying to remember what some of them were. It is interesting, we were talking about that with the mine site, about what would be a appropriate incentive. And it was interesting because one of the incentives that they had used recently that really had huge uptake and competition in the workplace was actually a hard hat that one of the workers is an artist, and they used one of the miner hats, and he did some artwork on the mining hat, and it was so popular. And so they were thinking about doing it again as an incentive. So really the incentives need to be really tailored to the particular group. I would have never thought of a miner's hat with some artwork on it that might be attractive to a group working. But I can tell you there was huge competition to get this miner's hat. It was like the thing. They were even surprised at how popular it was. So I think it really depends on the group. You know, I think that there were some, do you remember, Christina?
Yeah, I think that some of the things are simple with regards to water bottles, like very, very basic prizes. But like Joan had mentioned, it wasn't about what the actual prize was. It was more about you just got something. So we did have some shirts made up as well. And I think some of the, four of the companies actually held off and used those as incentives as well, rather than giving them all out at once. So I do remember like the water bottles, and did we have stress balls? Mm-hmm. Yeah, and I think we had stress balls, which again was interesting, but very minor incentives, but the idea was the competition was there. So, I mean, we could probably give them a pen and they would have been happy with that if it meant that they beat out their neighbor in the hall, in the room next to them.
Mm-hmm. I think that's all the questions right now from those online. Is there any in person?
Yeah, we have one question in the room.
Like everyone, I think I'm quite intrigued by men's aversion to fruits and vegetables. And I was just wondering, you had mentioned that men consume 3.5 servings a day, which is not meeting the minimum recommendation. What is the minimum recommendation?
Yeah, it's 5 to 7 servings of fruit and vegetables. So the question was, what is the recommended amount of fruit and vegetables? And it's 5 to 7 fruit and vegetables a day.
I wonder if those fruits and vegetables were incorporated into more manly meals, like vegetarian lasagna or chili or something, if we could
I think
increase those servings and maybe tie that to competition, like a cook-off or day week men making turns cooking.
We definitely have had some success with exactly what you're talking about. But with that in mind, what we did notice is we have to really teach the men, like their food literacy is not the highest either, right? So what some of the work that we're doing now too, we noticed that really simple meals, like throwing a whole bunch of vegetables, exactly what you said, into chili, is a great one. And you could use that with saying, you know, this is great to serve the guys if you're watching a football game or something like that. So we made it around that whole masculine ideal. So that definitely is one, but it really had to be simple ingredients and really easy to prepare and quick. So things like a chili or a fast stir fry where you could throw veggies in with some good solid meat, right? So we kind of were getting both in, but you're completely right. I think it's interesting about that fruit bowl that the individual online had just talked about, because we have seen some support for that and similar results for that, where if the men are provided with free fruit in a lunchroom, then they are more willing to go through there and take it. But it also revolved around the environment, the food environment. So, you know, in that same environment, was there a vending machine that contradicted that and provided unhealthy snacks, right? So if the culture around changed, then the men were more likely to. So it's interesting to see that, you know, where that didn't work. But it really depends on how you sell it, I guess, to the men or how you engage them. So it is a hard one. The challenges that we used in PowerPlay for the food challenges were somewhat difficult for men too, based on literacy. So one thing we did learn is we need to teach men how to prepare meals that are quick and simple. A lot of comments that we've gotten back from PowerPlay and other projects is, well, I don't prepare my meals and I don't do the shopping, so it's my wife's or partner's fault. Yeah, so how do we, you know, incorporate things like that? So once you teach them more and provide more information about good foods and bad foods, and we did that not just with fruit and vegetables, but here's a better cut of meat that you should consider, and throw it on the barbecue. You guys love to barbecue. While you're throwing that meat on the barbecue, here's some vegetables that you could throw on the barbecue that are quick and simple. So that's kind of what we're working on now as well.
Mm-hmm. If there are no questions from the audience at this point, Joan and Christina, is there anything you'd like to add following your presentation?
No, I'd just like to really thank people for joining us. And if you do have any questions about the PowerPlay program, I'd encourage you to contact us. We'd be happy to provide more information about the program. And if people are interested in thinking about implementing it in the workplace, we'd be happy to also talk about possibilities for that as well.
Mm-hmm.
Yeah,
thank you so much.
Just echo that. And I mean, I don't have the actual numbers, but I know we've talked about this before. It's quite a cost-effective program too. Mm-hmm. So for companies that are interested, it's a cost-effective way to implement some health-promoting behaviors, and with a little bit of investment, you get a lot in return.